Okay, everybody. Good afternoon. This is Danielle Watson with ROI Healthcare Solutions, and I want to thank you for joining today's webinar. It's entitled Clinically Driven Revenue Cycle. Today's session is being recorded, and we will send out the recording and the presentation after the call so that you can share this with your peers and your leadership team, and you can review the content once again. If you have questions throughout the webinar, feel free to send something via the chat box, which should be on the panel on the right-hand side of your screen. We have a dedicated time slot at the end of the presentation for answering your questions and getting your feedback. When you logged in, you should have received a PIN to connect with your web login. So the only way that we'll be able to hear you towards the end is if you have that PIN entered in and we can unmute you. If you have any issues with GoToWebinar throughout the call, please send a message to marketing@roihs.com. We'll have somebody monitoring the mailbox and answering your questions that way and getting you back on track. Okay, so we've got a couple of presenters today, Jeff Tennant and Lori Mandozzi. Let's just walk through some of the highlights of their experiences so you can really get an understanding of their perspectives and their background and what makes them credible sources of information. So first, Jeff Tennant, he is ROI's Executive Director of all things revenue cycle. Over the past 20 years, Jeff has served in various roles, including a hospital CIO, a consultant, a practice leader, and he is really passionate about what he does, and his passion is really contagious within ROI. He's innovative in how he does this, and he's committed to high quality performance and collaboration. And over the years, Jeff has created millions of dollars in financial gains for his clients. So we are really appreciative of Jeff being on board at ROI. Lori Mandozzi is our Director of HIS Services. And over the past 20 years, Lori has worked directly with clinical operations across many types of health systems, physician groups, and hospitals to drive clinical excellence, physician satisfaction, and an enhanced patient experience. Through her experiences leading and delivering complex engagements, sorry, I'm suffering with a cold, Lori truly understands the strategic and tactical elements of clinical challenges and solutions that have had profound impacts on organizational success. From a technology perspective, Lori has hands-on experience working with Cerner and Allscripts and Epic and Meditech and several other platforms. So we're so fortunate to have Lori on our team. So let's just talk a little bit about ROI, and then we'll dig into the meat of the presentation. So for the past 20 years, ROI has been working closely with healthcare providers as a trusted partner. We're headquartered in Atlanta, Georgia, and we work with organizations across the country, and we've recently expanded to provide international services as well. As a partner, we focus on trust and relationships and tangible results. And when our customers are successful, we're successful. We're also proud to be an award-winning partner in healthcare. And Class Research has designated ROI as the winner of their Best in Class Award for 2019 for partial IT outsourcing based on our application support services. We also have an ERP practice, and we've been a category leader based on our Infor implementation projects for the past 2 years. So we're really excited about that. We're also recognized by Modern Healthcare as a best place to work. We have been for 2018 and 2019. And this year, we actually have been recognized as one of the largest healthcare IT consulting firms in the country. We're also an Inc. 5000 fast-growing company, and we have been for the last couple of years. And we're just proud to, celebrate an internal culture of strong and passionate people, and we have a really positive work environment. We always talk about our people and when they're happy and they're passionate and doing what they're great at, our customers are happy as well. So that's really our motto. We also have a Glassdoor profile, and out of many reviews that we've received from our team members, we still have 5 stars. So in addition to providing great services to our customers and being recognized by Class, we also have many positive stories from our internal employees as well. All right, so let's talk a little bit about our offerings. So I talked about us being founded in 1999, so we've been around for 20 years. And several healthcare and health IT executives who had experiences working with large consulting firms and health systems decided to get together and combine the best aspects of their experiences working with those organizations. And they developed a vision for a no drama, high performing, passionate, knowledgeable, and collaborative organization. So they created ROI Healthcare Solutions with really the combination of their experiences. And when we first started out, we had a foundation of very unique project management expertise. And that really served us well, and our customers were very happy. And over the years, we realized that our customers had greater demand in other areas, and we expanded quite a bit to include advisory and optimization services, implementation services, support and staffing services across HIS, revenue cycle and ERP categories. I just want you to know too that we're not just committed to one technology. We have over 100 different applications that we've worked with across many of the large and moderately sized vendors in a number of scenarios. And one of our differentiators too, in addition to the services that we provide, is we're not just health IT. So we're not just hiring folks who have experience in Cerner or Epic or Meditech, but we actually hire clinicians and certified project managers and folks who have revenue cycle experience who also understand the technologies that we support. So we really bridge the gap between operations and technology to help our clients achieve success and create financial success for them, clinical success for them as well. So that's a high level overview of ROI, our service offerings, how we got started, how we've evolved, and how we're recognized in the industry. I'd like to pass it on now to Jeff Tennant, and he's going to dig into the agenda for today and the bulk of our webinar. Jeff?
Thank you, Danielle, and I appreciate that introduction. So in today's presentation, we have a few key learnings that we'd like to discuss. If you could go to the next slide, please. We want to look at how clinically driven revenue cycle is a combination of the people, processes, and technologies of your organization. We view revenue cycle as more than a click the box or check the box initiative, as so many of the mandates by the federal government become things like meaningful use and even MACRA to a certain extent, right? We want to avoid a penalty, so we're going to make sure we're compliant with this. Revenue cycle is much more than that check the box type of initiative. Lori's going to explore how the clinical process improvement is integral to ensuring that we are reimbursed accurately for the wonderful care that we're providing to our patients. And then we're going to look at where data analytics fits into this and how that can help achieve revenue cycle optimization. We're also going to look at how revenue cycle and an optimized revenue cycle, clinically driven revenue cycle, really supports your population health strategy. And without a well-defined and well-proven process, it's difficult to get to an effective population health strategy. And then we'll also talk about some of the tools that are out there that can help move your organization and really move you to a transformed mode. So organizational transformation, as opposed to just putting in some optimization techniques. So as we think about revenue cycle, what is revenue cycle? And in my opinion, revenue cycle is pretty much everything that happens to and for a patient from the time they determine they need a service done. Let's just say they get the sniffles and they go to their physician, through the end of that whole process, through getting that balance of their account to zero. Everything that happens in between, the registration process, the clinical events that happen to that folks, the documentation that is associated with those clinical events. Then those fine folks that do the coding and abstracting to make sure that documentation turns into a code that can be put on a bill. Then the folks who look at that bill, make sure it's correct and accurate, get it out the door to the payers, and then follow up with the payers, make sure that the status is what it needs to be, looking at how that cash is then posted, and then looking at the secondary billing, potentially for secondary insurance, or looking at the self-pay portion of that account. So we're going to talk about that kind of holistic look at revenue cycle as we go through this presentation today, and where the different pieces and parts intersect. So, what is the best way to manage your revenue cycle? It really is that combination of people, process, and technology, and where that becomes an optimized process. From your people perspective, right? You have your admission clerks, your billing clerks, your all of the folks that are involved in getting a bill correct and getting it out the door. Those people need training. They need to understand why their job is important. They need to understand what capabilities there are in the systems that you have in place, and then also looking at, potentially looking at partners to help drive those processes and help with that education. And then we look at the processes that are involved. Each one of those people needs to understand the processes and needs to make sure that the processes that they are utilizing are within what we would consider best practices, industry standards, revenue cycles, management standards and guidelines, looking at certain KPIs, what are your AR days? What are your denial rates? What are those, those numbers that we like to manage to? And then looking at a governance model so that the entire organization is involved in the processes that drive an improved revenue cycle. And then, the technology, there are great systems out there, Cerner, Epic, Meditech, they all scripts, they all have great systems in place that can do the bulk of the things that need to be done. It's just that we do not leverage that technology to the extent that it should be, or our team is not, back to the people side, they're not trained and educated enough to utilize the system the way they should. And then leveraging that technology to do some of the analytics, to be able to audit what's going on and monitor your revenue cycle management performance to make sure that you are staying in line with those industry best practices. So what are the pressures that we're seeing in revenue cycle today? There's always regulatory issues coming down the pike that have to be kept up with, and a lot of those impact the revenue cycle side of things. If we look back on ICD-10, MACRA, and the other mandates of changing the way we do certain things in the billing department. ICD-10 adding numerous codes and making sure that we're able to better identify disease states and things like that. If we think about declining reimbursements, we've been hearing that for a long time, but it's still an issue, right? No, most of our insurance providers, are looking for ways to reduce cost, as are the healthcare organizations. So as they look at reducing costs, their reimbursement models tend to shrink as CMS has less and less money to work with every year. They look at ways of reducing that reimbursement. So we focus on that. We focus on the large volume of aged receivables. So as it becomes more and more difficult to collect that money, and as payers make things more complicated, your receivables tend to age. We look at self-pay accounts, the increasing size of your co-pays. We talk about how under Obamacare, a lot of folks who were Medicaid patients, and although Medicaid didn't pay extremely well, you knew what you were getting. Now you have people who may have large deductibles and really no way of paying those deductibles. So looking at what's the best way of getting to those co-pays and the co-insurance that's out there. And then the high cost of collections, right? Billing and collections, as things get more difficult, the cost to collect each dollar gets a little higher. So you have to really manage to a reasonable cost to collect. As we look at organizations that are transitioning from one system to another, whether it be, from Meditech to Cerner, Cerner to Epic, Epic to Cerner, whatever that transition may be, let's look at the migration plan and what you're going to do during that system conversion. Rarely would we recommend that one take AR from an old system and put it in a new system, but you do have to have a plan for how you're going to clean up that AR in the old system and run that down, for lack of a better term, to get those accounts to as zero or as close to zero as you can. One thing that's long time been a concern in the revenue cycle space is the skill of your employees, or the lack of skilled employees that are willing to do the job. Unfortunately, these are not your highest paid individuals in the organization, nor are they typically your highest educated folks in the organization. So looking at ways of training those people up, and then once you get them trained up, keeping them engaged and happy with their position to keep them engaged with the organization. Um, Technology, do you have outdated or underutilized technology, and where does that impact things like charge integrity or even your charge capture in your systems? Looking at your CDI, looking at your programs around that, what technologies you have in place, and are they the most effective and best technologies that are out there? And then, the whole process of collecting payments just continues to change, and we have to stay up to date on, what we can do to make that more efficient and effective. So as we look at claims management, right, and we look at just a claim itself, and the claim kind of matches up with the pieces and parts of revenue cycle we were just talking about. So the header of the claim, all that patient demographic information, the insurance identifiers, all of those things, as well as key fields to make sure you're identifying that patient correctly, so that when you do send that claim out the door, that it matches up with what the payers have in their system. Then the body of that claim, right? So the actual diagnostic information, the DRGs that are put on there, that are built up by your coding staff, and the actual charges associated with those are all tied to, and this is something Lori's going to talk about a little more later as well, tied to that clinical event. So the clinical things that are happening to him for that patient should drive the proper building of this claim, so we can get it out the door. And then managing it, right? So making sure that claim is built correctly, that the technology is doing what it needs to do, that it's being submitted to the payer in the best and most effective way. And then claims management, right? So making sure that you follow up on those when it's appropriate, not too soon, not too late, and making sure you're staying on top of it. And then just the standard patient accounting, following up with those patients on their copays, deductibles, and things that they still owe. Making sure your patients understand the billing system, and what they're being billed for and why. As we talk about claims, patients do not go to the hospital in order to get a bill, but if their bill is messed up at the end of that encounter, that's one thing that they'll remember. It's something that if you read on any of the hospital uh, websites, the complaints typically, a lot of them are around billing. They can have a decent clinical event, but the billing is screwed up, and that's the last thing. It leaves them with a bad taste in their mouth. So it is a patient satisfaction driver as well. So as we look at the challenges, right, in today's world, it's difficult to assess where you are in the process and where you match up with other organizations, and that's where leveraging a third party can sometimes become very helpful. And then as we look at the areas that you may need to have some improvement, how do you transform that, right? It's a lot easier to address a problem than it is to change the cause of a problem. And when we look at the transforming of an organization to what we would consider uh, optimized revenue cycle, it's really about transforming the organization so that you can sustain those changes, that it continues to drive for improvement month over month, year over year, and you're not just putting a quick fix in place. I know 4 or 5 years ago, probably longer than that now, there was a big push on cash acceleration, which cash acceleration was important, and can still be important, but it really just moves up the timeline of you collecting that money. It doesn't add to the process. It doesn't add to the bottom line over a span of a couple of years. But if we truly transform the organization and go to what we would consider clinically driven revenue cycle, where everything that's being done to and for that patient drives the proper documentation, that then drives the coders to put in the proper codes to drive proper reimbursement, it allows us to truly transform the revenue cycle and transform the organization and add to the bottom line. And then we continue to monitor that, right? Most systems have uh, the reporting in place that can allow you to manage against days in AR, DNFB, all of the key metrics that we would typically follow, denial rates, things like that. But monitor those things and continue to assess them. So it really is a circular motion. And as you find, as you start fixing certain areas that are what we would call low hanging fruit, then you start focusing on the more difficult problems, and really get into driving change, and transforming the organization to operate as effectively and efficiently as it can. So what we at ROI suggest is what we call our revenue cycle performance review. It's a scorecard-based assessment that quickly identifies areas of problem, or areas where your organization may not be functioning at a level that we would consider industry best practices. It's very process driven. We do a lot of interviews of staff that are utilizing the system, and it does a great job of defining where you are today and identifying those areas that can be corrected or changed in order to drive to optimal processes. Out of that, we're able to build a real solid roadmap of what we would like to see toward the future of your organization, and how that will impact your bottom line. We can typically identify millions of dollars in potential improvement. I can't think of any organization I've worked with so far where I didn't identify well over $1 million in opportunity to improve their bottom line. And not just increase their revenue, but truly impact their bottom line and get net revenue back in the door through process improvement. So as we look at all the pieces that are related to revenue cycle transformation, and like I said, Lori's going to talk significantly about our clinical focus as well, but we look at, patient access. Patient access is important. It's the first touch of that patient coming into your organization. So making sure that information is being captured correctly and gives you the data to drive through that entire stay and make sure that everything that is being done for that patient is accounted to the correct person and gets to where it needs to be. Clinical documentation, which drives, everything, but making sure that clinical documentation and the way the system is set up also drives for better coding, making sure that your HIM staff is able to code correctly and get the bills out the door. Patient financial services, making sure that everything that's captured in the front end transitions to the back end of the revenue cycle process, and that you do get an appropriate bill out the door in a timely manner and are able to follow up and make sure that that's paid in a timely manner as well. And where we look at this as a puzzle with all these different pieces, we feel that for your organization, possibly our clinically driven revenue cycle transformation service may be that missing piece, and we can help fill that gap for you. So as we transition to Lori, and she speaks a little more on the clinical side, I just want to thank you for your time this afternoon and transition it over to Lori. Lori?
Thank you, Jeff. Can everyone hear me?
Yes.
Okay, great. So thank you, Jeff. And now for the clinical lens of that circular motion of process that you were referencing before. Orchestrating the care continuum in clinically driven revenue cycle is very much like creating music in a symphony. Each musician contributes to the overall product, and the conductor ensures that all instruments are playing at the appropriate time to deliver the best sound. It could be said that the care continuum is like an orchestra, and each component of the continuum, from registration to care delivery to back office functionality, are instrumental in clinical and revenue cycle outcomes. Next slide, thank you. So where are we now on the clinical side? Providers and caregivers are oftentimes burdened with processes that are not part of their patient care workflow. I'm going to talk a little bit about how did we get here. As Jeff indicated earlier, there have been multiple federally mandated initiatives such as meaningful use, MACRA, regulatory compliances, ICD-10, etc. And when the EHRs were implemented with clinical focus, as they should be, the clinical work processes were dissected and analyzed and implemented. Back office functions were largely afterthoughts. And unfortunately, what we have seen is there was an impact on the bottom line. Jeff referenced that previously. Physicians, advanced practitioners, and nurses have been fairly far removed from the financial aspect of care. This group has not been involved with predicting revenue, cost to collect, days accounts receivable, revenue stream, and bad debt. And during the initial phase of optimization of the EHRs, oftentimes the reaction was plug the hole approach. And what I mean by that were initiation of hard stops in the clinical process to try and drive the electronic process of patient care to get the appropriate data needed for revenue cycle. This oftentimes had a direct impact on the providers who are trying to perform direct patient care. And over the last few years, this has contributed to what we are now hearing as provider burnout. What is our destination? Our destination is to drive health systems to clinically driven revenue cycle optimization transformation. Next slide. So I wanted to bring this down a little bit more granular. So let's talk about the claim being built in parallel at the point of care. Let's say a patient gets registered for acute respiratory distress. A financial manager could have the potential to predict the average cost for care in each of the areas that this patient can touch, such as the ED, a therapy, ICU, or on a floor. And as orders are placed, the bill continues to build. Lab orders, ancillary services, radiology orders, and nursing costs are being added. Back office oftentimes has the ability to monitor this real time. Case managers and utilization review teams often monitor for ensuring that the cost of care does not exceed the average or expected cost. And then once discharged, the data points are collected, medications, length of time for critical care, condition, and provider notes, all streaming down to create the bill. All of these areas have the ability to be optimized and transformed for better efficiencies and outcomes. I wanted to point out in particular the provider notes, as these have now become a real hot button topic of burden to providers. Provider notes are originated in the communication and dictation to indicate what happened to that patient as to colleagues and other providers, and also to coders. And in this new world, because it is such a driver and a point needed for generating that bill, the clinical documentation and provider notes are expected to be completed as close to real time as possible, as they have found that there is a direct correlation between complete note completion and success to collect. The longer it takes to complete these notes, the less likely to collect or collect the correct amount. The impact of this type of process burden can be seen with physician burnout, inefficiency in your workflows, workarounds, and potentially an increased risk. So back to this slide should look very familiar. How do institutions move to this optimized environment of real-time data collection for clean billing? As with any organizational change, the basis is rooted in people, process, and technology. And thus, CDRC transformation from the clinical lens is no different. Critical success factors include adoption, sustainability, and accountability. On the people side, assessments are available for adoption metrics, and they're out there. There's obviously an opportunity to leverage those to a greater detail. There's education initiatives, as adoption and education are interrelated. Communication. How will we communicate to the end users? This is constantly changing. It should be monitored and evaluated for its effectiveness, because you have to be able to measure your success. You need to define it and be able to communicate it. How do we measure the understanding and acceptance of a change? Governance and accountability falls under people. Leadership must support and provide accountability and structure, and be able to identify and communicate what the process of this accountability is. Sustainability and support. Staff need the resources to perform their jobs, and they need to know the impact of what they're doing and understand the big picture. And understanding of how the ongoing communication and education is handled. Is the plan for change sustainable over time is a question that we should all be asking ourselves every day. And on the process side, key drivers in deciding work process evaluation and reprocessing has the best chance of success when it is based in value propositions for the clinicians and providers. meaning they need to understand what the win is and have a better understanding of the big picture. The providers and end users, if they do understand the overarching impact, will have a better chance of adoption and success. As too often in the past, singular groups, whether it was IT, quality, or a formed group for an initiative, were making decisions in a silo and therefore pushed the resolutions upstream, creating that potential overburden on the providers. In order to increase your success rate when moving to an optimized CBRC, there are a few key aspects you must consider. 1, truly evaluate current work process. 2, understand key needs and workarounds. 3, identify your champions. And 4, fully leverage your technology, current and new, identifying what is the change needed and how it will impact the end users. And then finally, the third prong, technology. It is extremely important to have a full understanding of the current depth and breadth of the application suite. And that includes support needs, the integration piece, and all the work processes that are associated with those applications. It's a big job, but is truly necessary when you're going for a transformational change. Leveraging analytics for key metrics to aid in what will become the ongoing communication strategy of the organization. Nothing is stronger than true validated numbers. People want to see that the change that is being made has had a positive impact. And those positive metrics may be different for different audiences. So it's important to understand what is the value proposition for those receivers. And true with technology as any other piece of this triangle is the communication. And having a strong communication strategy around your technology will assist the organization across all areas of CBRC. Questions like, what are we doing? Do people understand it? Is it working? And how do we know? How do people find out the information? Are key questions that we should be asking. And then, of course, in the end, a strong change management strategy, a need in every organization. Okay, next slide. Thank you. And I'll finish up on this because it's important as we move into this next level of technology transformation. So we've been sitting in the land of optimization, which is a subcomponent of transformation, whereby optimization is an adoption of those superficial short-term boosts, which is extremely necessary, initially to get through some of those bumps and bruises that we're going through. But they're often done in a disparate way with no overarching strategy, where we need to now move into that transformation form where solutions address universal business and operational challenges. It's harder, but it's necessary. And I think that even the term clinically driven revenue cycle hits on this, where the need may be in the revenue cycle end, but has a direct impact on care delivery. And those two have to come together in order to form fundamental change and creating something that is sustainable and measurable. All right, I will now turn it back to Jeff, who will talk to our key takeaways.
So as we look at today's webinar and what we've been talking about, so the questions we'd like for you to ask yourself and think about is, are your front end staff today, are they collecting the needed data points to drive the process, right? So as we talked about with Lori and the orchestra, are they getting the notes on the page so that the musicians are able to play their music the way they need to play it? Do your systems support the workflow of the clinicians, right? Are we asking our clinicians to do things that are outside the workflow? Are we asking them to go back and enter data, enter information that could be part of their natural workflow? Is there an opportunity to improve the processes of their workflow or the processes of the system to accommodate their workflow? Ask yourself if your physicians are satisfied with the systems that are in place. If the physicians aren't satisfied, there's a possibility of a couple of different things that could be going on. One, the technology simply doesn't support their natural workflow. Another, though, which is something that is typically the problem, is they're not aware of or trained on the functionality of the system. Our vendors out there, Epic, Cerner, Meditech, Allscripts, they all do a wonderful job of thinking about what do the clinicians need to do. And then we slap these systems in place and don't train our physicians how to utilize the system better. I was in a webinar and a panel discussion a few years back at the Becker's conference, and we were talking about the fact that typically 40 to 60% of the functionality of the system is all that's being used by clinicians. And that other 40 to 60% that they're not using is probably the areas that would really help drive satisfaction. So when you think about that, is there an opportunity to do a better job of educating or making sure that the systems are set up correctly so the clinicians can utilize them and gain that satisfaction? This next question, which I don't know any organization that can answer yes to, is does your organization collect every dollar that it's owed? We see millions and millions of dollars each year be written off or just simply not collected by organizations across the country, and that's unfortunate. Those are dollars that can be utilized to do other things within that organization, right? Uh, Buy new equipment, add more clinicians, whatever that needs, whatever that is. But those dollars are simply being washed down the drain, for lack of a better term. And most organizations have a very difficult time even understanding what they're losing, let alone how to go back and try and recoup it. And which leads to the last question: does your organization have the ability to understand the root cause of the billing issues that they're experiencing, right? So are the technologies in place? Do you have the analytics, the reporting in place to be able to understand what is the root cause of any billing issues you're having, whether it's denials or just slow payments, things like that? So these are all things that we try to hone in on as we look at working with organizations, and we would like for you to consider these as well. So as we look at, what are the key things? Revenue cycle definitely is that combination of people, process, and technology, and not just what we would typically consider revenue cycle folks, right? It's the whole organization. If we look at, revenue cycle being more than just check the box initiative, as we talked about earlier, it's definitely has a much bigger impact than just avoiding a penalty. You have to get that money back in the door. Clinical process improvement, as Lori mentioned, and that transformation of those processes is key to driving an effective and efficient revenue cycle. When we think about the analytics, again, most of the systems have some level of analytics in there. There may be additional technology tools that would help to work on those analytics, and there are vendors out there that do a great job in that space. When we think about population health strategy, we didn't touch on this that much, but as you look at your population health strategy, it's really about more than dealing with the episodic care for a patient, and truly where that linear medical record comes into play. And as you can help manage that patient, follow up on them, see how they're leveraging their medications, things like that. Truly, the systems and the tools you have in place are really help manage that population health strategy. But without things being entered into the system correctly and driving correct billing and making sure that documentation is what it is, it's very difficult to manage those patients across that linear continuum of care. And then again, make sure you have the right tools in place. And if you don't, look for some tools that might help or help your organization get to where you want it to go. But that, those are the key takeaways. Those are the key things we want you to think about today. And I believe next we have opportunity for some questions. Oh, also wanted to mention some of the other thought leadership items we have out there. I've done a series on revenue cycle called Couch Conversations. It's kind of a fun little web series that I've done. We have some things around our project management series and other optimization that we have out there. So please feel free to go out and check those out on our website under Thought Leadership. If you have any questions and want to reach out to Lori or myself, our contact information's here, and you can download this after the session. But we welcome your inquiry. So does anyone have any questions? Danielle, I don't know if anyone's submitted any questions during the presentation, but if there are any questions, we'd be happy to try to address. I think we have about 10 minutes left.
Great. Well, thank you so much, Jeff and Lori, for the insightful webinar. I hope that everyone on the line, that you've enjoyed it, that you've gotten something out of it, that it's getting the wheels turning in your minds and thinking about what this could mean for you, what further dialogue could mean for you and your organization. So on the right-hand side, there is a panel where you can go to the chat box and you can enter a question. We've got a couple of comments already from folks. I know you're able to do that. You can also raise your hand as well. So I'm just going to wait just a moment and see what comes through. Okay, we've got some questions coming through. The first one is from Mark Steinkirchner, and the question is, in your initial email, you asked this question, are your POS cash collections above 50%? What are the metrics for that measurement? Jeff, you want to
Yeah, so that measurement is coming from what we would, the HFMA map keys, so when we're looking at your point of service collections, you want to make sure that you're collecting at least half of that money up front, whatever you can. We've found that in any organization, the earlier you collect that money, if you can collect it up front, the better it is. It's much more difficult to collect the patient portion of a stay once that patient is well and feeling better at home, right? So making sure that you're getting at least half that up front is what we consider a best practice. It's a good goal to strive to. Obviously, if you can get above that, that's great. But 50% is kind of that bottom threshold. If you're not hitting at least 50%, there's definitely an opportunity for improvement there through maybe some scripting or working with those front end staff on how they have those conversations, and also the technology that's in place. Are they able to take a credit card payment there? Are you able to take a credit card payment over the phone while you're doing scheduling? Things like that. So definitely, though, 50% isn't what you should strive for, but if you're less than 50%, you definitely have a problem.
Thank you, Jeff. The next one is from Rihanna Hussein, and it is, how do you engage the other cross-functional owners to optimize the revenue cycle process?
So I'll take the first swing at this, and I'll let Lori comment on it as well. But it is really about leadership, right? So as Lori was talking about the orchestra, the conductor, the leadership of the organization has to be on board with these initiatives. And it really is about educating leadership on why these things are important, right? It's easy for the CFO, I won't say easy, it's common for the CFO to continually harp on the revenue cycle organization that they need more money. But when you look at the drivers and the clinical components of what it takes to get a correct bill out the door, make sure you are accurately and timely being able to bill for everything you're doing to and for a patient, that requires more than just financial leadership. You have to engage the clinical leadership as well, your CMIO, your CMO, CNO, even your CEO and COO need to be involved in these processes. And that's where setting up a proper governance structure and really having a revenue cycle transformation team in place is extremely important. Lori, I don't know if there's anything you wanted to add to that.
No, I think you're right on target. What I'm seeing in the marketplace is a shift in roles, and for like the CMIO and the CNO, I'm seeing CNIOs leaders through these technology changes now, which is definitely a shift. And governance is key, and accountability is key. So again, when I was talking about having a value proposition to your providers, that I have found is extremely important. If they feel again that they are going to be burdened with additional work time, because that's what we're being measured as an impact to the providers, you're going to have dramatic pushback. So you have to ensure that, one, you have the governance, two, that your technology is being truly leveraged, and have a key stakeholders that can provide that value prop to the end users that will be directly impacted. I hope that answers your questions. And if not, feel free to reach out to us after, and we'll continue this conversation, because I'm quite passionate about it and can talk about it for a long time.
Wonderful. We've got a couple of additional ones. The first one is, you've mentioned the ABN process. What have you seen work, and what does it mean for people on Medicare that cannot afford to pay for services?
So that's a great question. And I still am somewhat amazed at organizations I go to that do not have an ABN process in place, right? So they're not, they just choose not to deal with it. And even in today's world, and that seems like that's, several years ago should have been taken care of. But truly, a true ABM process isn't about trying to collect money from Medicare patients or Medicaid patients. It's about informing them that the test or the procedure that's been recommended for them is not what CMS considers clinically necessary, and they're not going to pay for it. What typically needs to happen is that the registration clerk or the front end staff need to reach out to that provider and find out why, right? Typically, providers do not request procedures and tests that aren't medically necessary. So maybe they didn't put the proper admitting diagnosis, or maybe they didn't put the diagnosis the way it should be, or they haven't added a modifier. So, something to that effect in the request, the order for that test. So reaching out to the providers, to the provider or the provider's nursing team, and getting additional information. The goal should be to always get it covered by the insurance entity, right? So that's what you're striving for. And then, at the end of the day, if it is something that the physician wants to have done, but the insurance isn't going to pay for it, then we have to inform that patient that, hey, your insurance isn't going to cover this, and it could fall to you for payment. So it's really about educating the team of going back and trying to get more clarification and get that covered if possible. And as a last resort, then you work with the patient to have that ABN signed, so they are technically responsible for the bill at that point. I hope that answers the question.
Great.
And can I piggyback off of that? So just for the group, if you notice that both of Jeff's answers included education reference to the registration folks, and Jeff and I have had multiple conversations and initiatives around this, and becoming more proactive and creative in your registration education initiative, as there tends to be turnover, there's tribal knowledge, workarounds, yet it is key for many of these point of contacts with an impact with the patients, and ultimately impact to revenue cycle. So I think that's a key component when we're talking about that whole registration, staff, and education needs. We could do an entire webinar on that. More to come on that.
Maybe that's our next webinar. I think Lori just signed up.
There you go.
All right, we've got one last one. What are the areas that you typically find that need the most room for improvement?
Well, that's a really good question. And it's not, I don't know that there is one particular area that we typically find. Most organizations, the registration team, the registration clerks are an area for potential improvement. A lot of organizations struggle with denials management, right? And I think I wrote a white paper on this a while back. Why do we manage denials? Why don't we fix them, right? The organization or the nomenclature in the industry is to manage those denials. It's interesting how we've grown accustomed to that, but at the end of the day, denials management is really important, because everything that's denied, if you don't resolve that correctly, that's money that you're taking out of the organization's pocket and throwing it away. One area that I'm passionate about is timely filing denials. If you're not, if you're getting significant denials, writing off a lot of money because of timely filing, that's just that's deplorable to me. You may as well be wadding up dollar bills and throwing them away. Clinical documentation is always an area that could stand improvement, or seems like it is. There's always opportunity there. Clinicians do as best they can under the circumstances they're in, but making things more workflow friendly for them, making it easier for them to do the right thing and more difficult for them to do the wrong thing, I think is important. But those are the areas from a revenue cycle perspective that we see. I think we could spend hours on case management and how that can impact an organization's bottom line as well. But that's a much more difficult dollar to identify. Length of stay and things like that, getting patients out of the hospital when they should be, and planning that and moving forward. So again, leveraging the technology and not being educated on the capabilities that are in place with the technology that's already in-house is typically where a lot of the opportunities for improvement come from. So maybe that would be one of the areas that I would say is typically a problem, is education on how to utilize the system better. Lori, I don't know if you had anything you wanted to add to that.
But you're spot on that, Jeff. Thank you.
Great. Well, I think that's all we've got for today. Thank you everyone for joining. We hope you got a lot out of this, and we look forward to some continued conversations. We'll send out the presentation as well as access to the recording. So take a look through this content, jot down your notes and questions, and reach out to us. We'd love to connect with you. Thanks everyone.